Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
In light of the recent tragedies in Newtown, Connecticut, today we're here with child psychologist Dr. Moore to talk a little bit about, in the wake of these events, how are we supposed to talk to our children about them?
Well, I think at this point, probably all parents have had this discussion with their children, and parents have made a decision about how much information to share. At this point, the decision is more about how to keep talking about it, whether to raise it if the child seems to have stopped asking about it, and how to kind of monitor for any concerning emotional reactions over time.
If your child isn't talking about it, or you haven't felt like you've gotten enough out of them, is there ways you can see if they're internalizing it or if it's affecting them and they're not talking about it?
The child has a history of kind of trying to avoid emotional topics, but then becoming upset about them later. That parent might be a little more persistent in asking the child to spend a little time talking about it or in checking in a little bit more frequently. Whereas if the kid is kind of one of the more resilient kids that just tends to be like, I'm just not going to think about that, and they can generally move forward in that circumstance, and that applies, I think, to the vast majority of children, then I think it's fine to kind of let it be and just be available for questions.
Parents having more of a difficult time sort of processing this information than you think the children possibly are?
Well, that's sort of what I've noticed more on an anecdotal level based on my contacts with school systems, patient population and so on, is I'm hearing tremendous distress from the parents around this, and people are still actively processing it and looking for ways to make sense of it or move themselves forward past it. Whereas a lot of the kids seem to be sad, concerned, but also it's not in the front of their minds the way it is for the parents.
Moving forward, what's the focus when it does come to your children? Is it more reassurance of safety in school, or is that really where we're headed with trying to make them know that they're safe so they do feel comfortable?
What you really want to do in a discussion with your child is make sure that you're starting off with a child-centered discussion. So what is the child experiencing? What might the child be concerned about? As opposed to starting to address concerns that you're having.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page. Caitlin Tivnan, stay healthy.